Alrighty, so you've chosen to do Kybella, and this is an FDA approved treatment to deal with fat. And the FDA approved area is this submental area, which is this under chin area. And so what this product really is, this medication really is deoxycholic acid, and what it's doing is it is actually breaking apart that fat cell membrane and allowing the fat to just get destroyed. You will have swelling from this, potentially some bruising, so it's not for something you just do on the fly. This does require that you do a series of treatments. This is not just a one-time treatment unless you have a little bit of fat in that area. Most patients will need about 2, possibly 3 treatments, treated about 4 to 6 weeks apart from each other. Now, Kybella can also be used on other areas, including fat raw areas. You can do a little tummy areas if it's a small little pocket. You can do around the knees. So this is any area which I would consider a small pinchable area. Even I've done it on the cheeks area. These are all considered off-label, of course, but you can really target and really be precise about trying to get rid of fat in certain areas. As far as getting prepared for this treatment, there really is nothing you need to do except be prepared that you will be swollen. So this is a preparation game that you will be swollen possibly for about a week or 2 weeks in the areas that are treated. One thing I do want to mention is not for you to not take any anti-inflammatories the first about 2-3 days before and at least a couple of days into it, because you want the inflammatory response that will actually start to kill off the fat cells. The treatment itself, we ice you. We'll probably put a little tattooing just so that we know a grid of what areas we want to address. And we literally take a tiny little needle, insulin type of needle, and we're putting about 0.1 to 0.2 cc's of this medication into the area of the fat area. You should start within a minute or 2 minutes, start to feel a burning sensation, and that burning sensation can last up to about half an hour to an hour, maybe a little bit longer for some people. But that burning sensation is you knowing that the actual fat cells are starting to get destroyed and killed off in that area. Okay, so once we're done injecting the whole area, you go back to putting ice. You'll hang out here for another 5, 10, 15 minutes, continue to ice until you're comfortable leaving, and that's pretty much it. Now, post-treatment, what you should be looking forward to is you will have some swelling. There may be some sensation changes. If you happen to get some inflammation near the mandibular nerve, especially in this area, you may get a little bit of weakness in the muscle in the area. That will all completely resolve. Sensation issues as far as touching it a little bit more numb into the area. Definitely possibly some bruising, definitely for sure swelling is definitely expected. So this is something you want to prepare mentally, that these things can and will probably happen. Not all of them will happen, but for sure swelling and potentially some bruising can happen. You want to ice as much as possible, just no anti-inflammatories. If you want to take something for pain, Tylenol is a perfect alternative for it, but just no Motrin, ibuprofen, any anti-inflammatories, because you want that inflammatory response. Now, the soonest you can come back and get treated is about 4 weeks out, but typically that's about the time that everything, the swelling is starting to resolve, and then we're finally starting to see the results. But if you know you're going to need it a little bit sooner, you can do it as every 4 weeks, but typically about every 6 to 8 weeks is a perfect timing to retreat the area. Okay, so we're gonna go over the consent for Kybella. So these are all the things that can possibly go along with your Kybella treatment. Always in the back of our minds is an injection, also possibility of infection. These are rare complications. The biggest ones that I do see are gonna be your swelling, which I tell everybody you will swell like a bullfrog. So plan it out, at least a week to 2 weeks of swelling. Potentially some sensation changes, I definitely do notice that, and then potentially some bruising. Those are your major big ones. All the rest of them are small and very rare instances that you do get them, but we have to document and we do have to tell you those are possibilities. So hopefully I've gone over everything with regards to your Kybella consent. Very simple, very easy treatment. If there are any questions that I have not answered or not gone through, or something's arise that you want to ask us, please ask one of the providers before we get the treatment done. Otherwise, sit back for some burning off of this fat.